I'm Antoni Chan, reporting for Room Now in EULAR 2025 in Barcelona, and some interesting new ways of delivering care in axial spondyloarthritis was presented at EULAR 2025. And one of the interesting abstracts was poster 0122, which was presented by Dr. Uta Klitz from Germany. And this is using digital behavioral therapy for patients with persistent pain in axial spondyloarthritis. So I'm very happy and delighted that Uta Klitz can actually join us here to describe the abstract and also to discuss this in a bit more detail. So Uta, welcome, and I wonder whether you could take us through your poster and abstract.
Yeah, Antoni, thank you very much for this possibility to present my data. So we ask ourselves, how can we improve care for patients with axial SPA? And a problem that quite frequently occurs in patients with AxSpA is chronic pain. So we thought about investigating whether digital behavioral therapy would be efficacious in our patients. So we designed a randomized control study by randomizing patients to a treatment arm, that's patient with a stable medication, but we prescribed a digital health application, and the other group were a standard of care group who did not receive the digital behavioral technique app. So we used an app which is approved by regulatory authorities in Germany that consists of 7 different lessons on which the patient learned what is pain, some pathophysiological background, but more importantly, all these aspects of behavioral change techniques. And the patient was also able to practice and to use the knowledge, and also to have some background information by psychologists if needed by the patients. So ultimately, we started our trial in patients with axial SPA diagnosis, chronic pain, and a stable medication. Majority of patients were on biologic treatment. We included altogether 136 patients, and the patients were randomized 1-to-1 in the treatment arm. So a patient with the app prescription were able to use the app. However, we investigated that not all patients use the app actively. So in terms of the analysis, we compared in our analysis only the patient who actively used the app versus the standard of care group. And we were able to show that especially the multidimensional pain inventory, who is assessing the interference of pain in daily activity, significantly reduced over the period of the study trial, which was not so much the case for the pain level itself. And we were also able to show that health-related quality of life improved. So as a limitation for our study, we saw that 1/5 of patients did not use the app. That had multiple reasons. One reason was that the prescription was not allowed by the healthcare insurance. But for the majority of patients, the main limitation was that the patients were not able to integrate the app education, app training in their daily routine life. So we were able to show with this study that a digital behavioral technique might be beneficial for a selected patient population with axial SPA. And we start thinking about investigating this further on.
That was very nice work. It's very clear that the ACT app group did better than the standard of care group in your study. Was there any particular subgroup of patients who, in your study, would seem to benefit more from the ACT app, maybe based on their age or digital literacy? Did you notice any subgroup?
So we had a quite a good age representation, and we didn't see a age restriction for patient groups for either younger or older patient groups. So no, we did not have this separation. We did a pragmatic trial, so for sure health literacy would be a wonderful outcome, but we didn't test that in our patient population. We, of course, we also talked to our patient. We didn't assess their opinion about the app. We did that in a standardized manner by using the usability score and also the net promoter score. And we identified those patients who actively used the app had a much more better net promoter score, and also rated the patient global impression of change much more in favor to the app compared to those who didn't use it. But in our subgroup analysis, and I think that's also partly of the sample for the quite small sample size, we didn't see a specific subgroup that benefit from the app.
So very interesting. And also at this conference, we did see a lot of new digital technologies in the field. Do you think that these ACT-based digital therapy will be maybe part of routine care in XPA in the future?
I think yes. But I think you also have to need a healthcare system that is supporting these digital technologies. And I think in this respect, especially for Germany, we now have the regulatory pathways to improve such devices. However, we also have to speak about costs. And that's not a small amount of costs if we are prescribing the digital ACT apps to our patients. So we really have to investigate further on who will benefit from the app so that we can prescribe the app in a more targeted way. I really appreciate that Germany is allowing this digital health application in a regulatory pathway, because we as physicians do not have to take care anymore for the safety of the patient in this digital health area, and also the data security options, because that already has been approved by the regulatory authority. So we just can focus on our patients. And yes, I would really love to prescribe that in a more frequent way.
Yeah, that is good news, and I'm sure it's good news for your patients as well, that they have the opportunity to participate in this form of treatment. And I think you raised a very important point, that the rollout or the implementation of such digital tools or apps is going to be also related to the healthcare system, remuneration, and also the insurers, so that whether they could facilitate the access to these digital interventions. So you've done a 12-week study here. Are you planning a longer-term study to see how this goes in the long term?
Yes, indeed, we are planning that. However, if you are thinking about that the app will then be used over a longer period of time, that's not totally foresee in the regulatory way in Germany, because we are asked to prescribe the app once for 12 weeks, and then the patient should be educated enough to use all these techniques without the prescription of the app. We can re-prescribe the app in patients who need more support, but I foresee that for the majority of patients, we will be only have a limited availability to prescribe the app on a frequent basis. I think
Yeah.
that's the limitation at the system at the moment.
It's great to hear from you about your poster. We're very excited to hear how this develops, and we can learn a lot from each other through the different experiences that we have with our system. So Uta, thank you for your time. It's been great to hear your work, and we look forward to seeing how this develops in the future. Thank you very much.
Yeah, thank you.